आता इंडियन लिबरल पक्ष विषयाचे सादरीकरण करेल. माननीय पंतप्रधान संचिता संदेचामुथा यांना मी विनंती करतो की त्यांनी आपला विषय मांडावा.
Good afternoon, respected chairperson, members of the jury, and the members of the parliament. I, Sanchita Sundechamutha, would like to speak on the topic Research in Precision Medicine. Precision medicine is a data-driven, knowledge-driven, compassion-driven, social intelligence-driven, genetically compatible, tailoring medical treatment and prevention systems for individual patients. Precision medicine is an emerging way of disease prevention and management. It involves tailored approaches, including predictive diagnostic, prevention, personalization, and participation treatment strategies based on genetic makeup and genetic modifications. This approach is a complete extension of the traditional way of one-size-fits-all to increase our ability to predict which medical treatment will be effective or ineffective based on specific mutations. Availability and affordability of genomic sequencing technology will boost advocacy for precision medicine approaches in India. Continuous and untiring efforts of scientists in assessing human genome and identifying genomic biomarkers have been fruitful. As of 2020, there are about 286 precision medicine drugs like cetuximab for lung cancer and abacavir for HIV prevention drugs. Precision medicine is used for targeted treatments of conditions like cancer, genetic diseases, cardiovascular diseases, infectious diseases, and central nervous system disorders. It uses preclinical data and clinical research findings, including pharmacokinetics, pharmacodynamics, biomarker, and genomic data to predict and optimize outcome for patient. This can be understood by the example of blood transmission. Like in blood transmission, one person cannot donate blood to all the people in the universe. Same way, one form of medicine cannot work for all the people having the same symptoms. A biomarker is a biological molecule found in blood, body fluids, or tissues utilized for early diagnosis of an ailment or disorder by analytical tools like molecular imaging, genomics, proteomics, metabolomics, and next-generation sequencing that have resulted in the development of over a dozen specific biomarkers. A genome is a person's complete set of DNA, including all the genes with more than 3 billion DNA base pairs. Genome sequencing will lead to precision medicine instead of clinicians giving drugs based on collective knowledge. In 2019, a woman 3 months pregnant visited a government medical college in Kerala with an unusual request to know if her second unborn child would develop a rare immune disease which her firstborn child was already suffering from. A doctor took up her case to the Institute of Genomics and Integrative Biology run by the CSIR in Delhi. Using genome sequencing, the scientists found out the exact genetic abnormality in the first child. To find out if the fetus too carried the same abnormality, tests using primers sent by IGIB showed that the fetus had no genetic abnormality. Nearly 7 crore Indians suffer from rare genetic disorders, making it a massive medical and economic burden. As no reliable genetic information of Indians is available for research, our scientists have to rely on gene data banks from the US and the UK or China. And US have over 10 lakh and UK has 1 lakh gene data. Precision medicine is a very useful method, but has some barriers in its implementation. Thus, I, Sanchita, as the Prime Minister, propose the following policies. Number 1, launch of the Indigen project. We just concluded a 6-month pilot project named Indigen of sequencing genome of our people with an Indigen card for healthcare and biomedical use. we have mapped genomes of around 1008 people across major Indian ethnicities to help researchers develop measures to prevent cancer and rare genetic disorders. Our government will work extensively to promote the participation in these projects. This indigen card has genetic profile of the person who possesses it. Also, all genetic disorders and genetic diseases likely to have been mentioned in the indigen card. Thus, the card possessor will take care of his health by maintaining his lifestyle. Also, the costs are likely to drop drastically as the chemicals are now readily available and major capital expenditure has already been undertaken. In India, it will cost around 20 to 25,000. Now, we lack sufficient number of clinicians with the genetic enterprise to provide a robust understanding of precision medicine to the patients. Due to the patients are likely to misinterpret the usefulness of precision medicine findings. Number 2, establishment of the CSIR, Council of Research and Industrial Research. To overcome this, CSIR is planning to train more clinicians for gene data interpretation and rope in more labs for sequencing. Apart from the IGIB and CCMB, NIBG and IISC will also be a part of this indigen project. There are also challenges for this, like data storage, tracking, inefficient regulatory processes, and complex supply chains also create barriers and bottlenecks that may hamper the equitable delivery of precision medicine to society. To overcome this, we are leveraging the latest technologies to improve treatment regimes, store patients' data, and tracking outcomes is essential for our country to reach our healthcare goals amidst changing environmental, economical, and social conditions. Number 3, collaboration with GFIN, Global Financial Innovation Network, and signing Agile Nation Agreement. To identify different subgroups of diseases, we need data to be collected from vast number of patients. It can be challenging to collect this data in hospital settings. It is also challenging to ensure it is accessible to researchers. Capacity building needs to be done at a breakneck speed, especially with respect to training of healthcare workers and availability of high quality AI, ML, and laboratory equipments. We will also join the GFIN, which is composed of over 60 organizations, to help firms to test innovative products, services across more than one jurisdiction. We will also sign an Agile Nation Agreement consisting of USA, Finland, etc., which aims to foster multi-jurisdictional cooperation by helping innovators navigate each country's rule, test new ideas, and collectively investing money across governments, academics, and private researchers and infrastructure development. Number 4, appointment of genetic counselors under the data security law. To mitigate to a person outcome, we propose rebate arrangements with manufacturer. Payments approach will be annuity payments till the therapeutic effects persists. In India, currently, health policy plan insurer charges annual fee of rupees 15,000 per capita. 1 in 1 lakh individual may suffer from a rare disease. As of now, the cost of tailored medicine, such diseases in America, is about 3 to 4 crore rupees. In India, the money amassed by the insurer is sufficient for an individual. Government-appointed genetic counselors will review test orders to allow health systems and providers to find ways to cut expenses and thus decrease genetic testing costs. Non-Discrimination Act will be introduced to make illegal to discriminate against employees or health insurance applicants because of genetic information. DNA privacy law will be introduced in which genetic information for insurance purpose prohibits life, disability, and long term care insurance companies from using genetic tests for coverage purposes. To advance pharmacy's knowledge in pharmacogenomics and precision medicine, certificate programs will be provided for a primary care workforce. India needs to build intelligent big data platforms that collect uniformly structured data, train healthcare workers in genomic build infrastructure, and involve patients and community participations for the sustenance and success of precision medicine. The recent initiative of Unique Methods of Management and Treatment of Inherited Disorders initiative and Nidan launched in September 2019 are progressive steps in this field. Our government will make a 20% increase in allocation of finances to the health sector. The government will provide a relaxation on the raw materials for medicines and diagnostic equipment and all supplies related to diagnostic testing by bringing down GST to 16%. This would enable the service provider to make the services more affordable to the consumers. 1.25% CDSEO to acquire additional expertise and advance the development of high quality curated databases to support the regulatory structure needed to advance innovation in precision medicine and protect public health. We aim to provide health insurance coverage to around 100 million families and further expansion of Ayushman Bharat scheme under this budget in coming years. We expect that encouraging eradication of labs is extended to Tier 2 and Tier 3 cities as well as to provide equitable access to quality health care. We do feel that at this junction, while the Make in India story continues to unfold, it is imperative to build a system where the industry, global players, and our government work together to map this market growth. Jai Hind.
यानंतर प्रश्नोत्तरांची वेळ सुरू होत आहे. पक्षाच्या नावाची घोषणा केल्यानंतर त्याच पक्षाच्या प्रतिनिधीने आपला प्रश्न विचारावा. भारत प्रबोधन पक्ष,
No question.
समृद्ध भारत पक्ष,
Hello. Dear Prime Minister, you mentioned that you will change all the economical, social environment. How you will change?
Thank you.
अतुल्य भारत पक्ष,
For these research purposes, you're going to need different type of genetic data. And how will you make people participate in this and make them give you the genetic data where there is a threat of genetic data breach because there's a possibility of the data leaking?
Thank you.
भारत परिमाण पक्ष,
Hello, I am Vedan Ghadge, an MP of Bharat Parivan Paksha, and I want to question you that, as you have mentioned in the speech, that the precision medicine cost 20 to 25,000. Isn't it most costly?
Thank you.
हार्मनी इंडिया पक्ष,
So, what are your planning about creating a branch about precision medicine and how will it affect health budget?
धन्यवाद. सर्वांचे प्रश्न विचारून झाले आहेत. माननीय पंतप्रधानांनी उत्तरे द्यावीत अशी मी त्यांना विनंती करतो.
Okay, so the first question was related about economical and social, like how we're going to bring changes in that. So basically, by using precision medicine, it is a one-time investment. So if you invest in precision medicine, you will be a fully healthy person, and health is the most important factor for us. And with that, you will become a asset for the economy. So that is an economical change as well, and social change also. So the second question was about the data, genetic data leakage. So in our speech, we have mentioned that we are going to collaborate with a number of institutions, organizations, and therefore we are having a body which will keep your genetic data private, and we will not have the reports based on your name, but instead it will be based on the barcode, and it will be only known by you and your doctor, and unless and until without your consent, it won't be given to anybody else. And about reduced cost, like it's high cost. So basically, precision medicine cost ranges right from 10,000 to so on, and the cost which we have mentioned is 20 to 25,000. That's regarding cancer, and as I said, it's a one-time investment. And as the demand for precision medicine increases, as more and more people will start adopting this precision medicine, the cost will also reduce. For example,
धन्यवाद. माननीय पंतप्रधानांची उत्तरे देऊन झाली आहेत. आता ज्यांनी प्रश्न विचारले आहेत त्या 5 खासदारांनी कृपया उभे राहावे.
Hello?
आता माननीय पंतप्रधान आणि खासदार यांना एकत्रित चर्चेसाठी 3 मिनिटांचा अतिरिक्त कालावधी देण्यात येत आहे. कृपया चर्चेस सुरुवात करावी.
Hello.
So I want to ask
I'm
you,
not. I'm not agree with your question, with your answer, because you said that if the demands, म्हणजे तुम्ही म्हणलेले आहात की जसे जसे डिमांड्स वाढतील तसे तसे तुम्ही हे प्राइसेस कमी कराल. पण समजा की एका पर्सनला कॅन्सर झाला असेल आणि जर ते डिमांड्स आहे ना जास्तीत जास्त किंवा 1 किंवा 2 वर्षांनी वाढले, तर मग त्या पर्सनचं काय होणार जर त्याला पेच करता नाही आले तर ते पैसे?
बेसिकली ह्याला आम्ही इन्शुरन्स प्रोव्हाइड करतोय की यू कॅन ऑल्सो पे द पेमेंट्स इन EMI. अँड कॅन्सरला ते कॉस्टलीच असणार आहे, कॉज कॅन्सरमध्ये ती DNA ची सिक्वेन्सच चेंज होते. अँड तुम्ही जर प्रायव्हेट
You didn't answer my question.
येस,
You didn't answer my question.
कॅन यू प्लीज रिपीट?
So what are you planning about creating a branch about precision medicine, and how will it affect the health budget?
We have mentioned it. We are planning to implement it in India. In US, it is implemented, and it has been 40 years for them to implement it. And we will increase the budget by 2.25% as given by our finance minister for
Won't
genome
it affect the
testing.
health budget?
I want
It is
to
already
ask you
increased,
about
which is
the-
going to get funding from them. It is
I-
given.
I want to ask you about failures in the even about funds. What if you are not able to acquire that amount of funds, or maybe in collection of genetic data? I don't think people will be that amount of give that amount of support to just give out their genes and for testing. So how will you convince them? There's just no reason that somebody would give their genes or DNA for testing. Why would they agree to this?
Okay, so the first thing that we I had given the example of blood transmission. So if you want to donate your blood to someone, and if you donate your blood, like suppose it's O positive, it's B positive, and you donate it to A positive person, he's obviously going to face a problem because it will not match. And for that, you need testing. Same way, we have several types of diseases, and each disease will not have the same medicine, though it has the same symptoms. We also we have API. That is, India is the 3rd largest economy, and we import most of the medicines, export most of the medicines to the countries, and from that we can get the funding for precision medicine.
Hello.
Again, there are.
Excuse me.
This is India.
I have
in that.
another question, that the people in the rural areas cannot afford the insurance. Then what will you do?
We are first going to implement it in the metropolitan cities. so that first the awareness is spread among the people. First, so that the people see the benefits of precision medicine. And as it is a one-time investment, as the most important thing, your health is secured, so many people will invest in that.
कृपया आपली चर्चा पुढच्या 30 सेकंदात संपवावी.
In a country like India, which is this big, is it really necessary for bringing precision medicine, or it is just because other nations who are capable to do it, you're trying to do it just to implicate them, or just, or is it really needed?
It is not to replicate other countries, but instead there are many diseases which are not treated in the right time, and with the help of precision medicine, those diseases can be treated, which is a growth in the economy of a country itself. And for example, if you take the drug abacavir, it is just costing of around 5 to 10,000, which is used for treating of HIV disease.
And
धन्यवाद.
Thank you.
धन्यवाद. आता सत्ताधारी पक्षाने आपला ठराव सदनासमोर मांडावा.
The ultimate goal of our government is to provide optimal therapeutic with minimum iatrogenic damage and medical expenses with the right drug to the right patient in the right dose at the right time and avoiding harm to the patient. This will be done by the introduction of the indigent program, the establishment of the CSIR, collaborating with over 60 organizations for machines and knowledge, introduction of Non-Discrimination Act to protect genetic information, and further expansion of Ayushman Bharat scheme to provide equitable access to healthcare. Thus, I request you to cast your vote in my party's favor so that our government passes this bill in the favor of the people. Thank you.
पंतप्रधानांनी मांडलेल्या ठरावावरील मतदानासाठीची वेळ आता सुरू होत आहे. ठरावाच्या बाजूनी 12 मतं आणि ठरावाच्या विरोधात 12 मतं पडलेली आहेत. त्यामुळे मी सभापतींना विनंती करतो की त्यांनी आपलं वोट इथे कास्ट करावं आणि त्याचबरोबर या विषयावरती मार्गदर्शन करावं.
काही रायडरसह मी ठरावाच्या बाजूने माझं मत देतो. आता रायडर काय आहे ते मी सांगतो. पहिली गोष्ट, इट वॉज अ फंटॅस्टिक एफर्ट ऑन युअर पार्ट, ऑल ऑफ यू. Good, everyone participated. The topic was quite difficult, and I suggest that you should also try to understand the undercurrents whenever some innovation is being put forth before any parliament or any new idea is coming. We really don't know in this complex world whether somebody has a hidden agenda to push forth their part of it, right? And we don't really know whether in the name of genome sequencing there is some hidden agenda of data mapping or data being stored somewhere else or being used by some other countries. So there has to be discussion on data protection also. What is the mechanism that is being arranged for data protection in the long run? We nowadays almost every day you will find a news that X data was misused by Y company for some jade purpose. Like a very small food delivery boy, he collects the mobile number and he hands over those numbers to some third party, and it is being misused for crime. So this we have understood. So that is why we should be very careful about data protection. But overall, it was a fantastic effort on your part. Congrats.
धन्यवाद.